Hello and welcome. I'm Preeti Prakash. History will document these times in nothing less than a catastrophe where millions of millions across the world have lost their lives from a virus that traveled from Wuhan, a city in China, to the whole world, bringing not only the economies down to a grinding halt and to their knees, but also the suffering that it has perpetrated on the people. This pandemic is no different from the earlier pandemics of 1918 and the other of 81, the swine flu and the HIV AIDS, in the sense that people lost their loved ones in an innumerable number. But how it is different this time is that we've heard serious and very gory and striking stories of people in India particularly abandoning their loved ones' bodies in the rivers and burying their dead under the sand at the riverfront. People have been facing oxygen problem, and people have died because of lack of oxygen. We've had medicines out of stock from the counter. Vaccines also fell short. So whatever the reason may be, but these are critical times, and such times need critical care, and COVID is surely one of that. So to talk about the needs and the importance of critical care, and what all it entails and how all it works, I'm joined with me by Dr. Tarun Lall, who's a critical care specialist. He is a senior professor and medical officer in charge. He's the head of department of anesthesia of Jaipur Medical College. He's in charge of the largest designated COVID center at the Rajasthan University of Health Sciences, and he's also heading the trauma center at Jaipur SMS Hospital. Welcome, Dr. Tarun Lall, to my show. I'll just dive into the
Thank you very much. Thank you very much, ma'am, for having me on your show. Thank you.
So I'll start with the basic question. You are a critical care specialist of the state, I think. So what does critical care entail, and what is the role of a critical care specialist in COVID pandemic?
So as you told me, okay, I'll introduce myself again. So I'm a senior professor and heading the trauma center, and of course now heading the Department of Anesthesia at Rajasthan University of Health Sciences and the ICUs and high dependency units. So my expertise as a critical care specialist helped me to take over the COVID-19 crisis in our state, especially in Jaipur and at our Rajasthan University of Health Sciences. In trauma center, we used to have a trauma triage area. It's called the trauma triage area. So we would have a red area for the most seriously ill patients, and a green area, a yellow area, and a black zone, So similar, we have now a COVID triage area in the Rajasthan University of Health Sciences. So patients who've come gasping right now, so they are immediately shifted to the red area. And from the red area, they're directly transferred to the ICU where our anesthetist and medicine department team are ready for them. Then comes the yellow area where the patients are very sick, but not really gasping. They're like, it's not life-threatening right now. They are sick, all right. And then comes the yellow area where the patients are COVID positive and they're okay as such, right? So these are the three areas. So COVID triage area is also almost the same as the trauma triage area that we have.
Okay, so my question was, what does critical care entail, and what is the role of critical care specialist in this COVID pandemic?
The critical care specialist takes charge of all the different forms of oxygen that is being given to a COVID infected patient. So a COVID infected patient may need oxygen in different forms. It may be in the form of a simple nasal prong, which consists of 2 liters of oxygen and prongs in the nose of the patient. Then it may come to a high flow mask, A high flow mask is giving, say, 8 to 10 liters of oxygen. Then comes a face mask with a reservoir bag attached to it. So that is a non-rebreathing bag. From there, we go to high flow nasal cannula, giving 45 to 60 liters of oxygen. If that doesn't suffice, then we give to non-invasive ventilation with pressure support ventilation on a ventilator. And if that still doesn't work, we intubate a patient. So a critical care specialist gives all forms of oxygen from the nasal prong to the invasive mode of ventilation, which is intubating and putting him on different modes of invasive ventilation, like continuous mandatory ventilation, SIMV, different types of invasive modes of ventilation. So huge cycle there. So critical care specialist just does that, and it's very, very important for the patient right now.
So is that just related to oxygen support providing, or other issues also, like medication?
Besides oxygen supporting, we give treatments, different treatments to the patient. The different types of treatments could be basic antibiotics that we give. Basic antibiotics are being given. Then remdesivir treatment might be tried. So different types of treatment as well. Bactim can be tried. Lots of different treatments can be tried with these patients. So a critical care specialist takes charge of the whole scenario of the COVID patient, from a simple breathing ordinary patient to a gasping patient.
Doctor, please explain to our viewers what a cytokine storm. It is a term which has been very commonly used these days by medical.
Yeah. Cytokine storm is a very, very serious manifestation of the COVID virus right now. So cytokines are basically different types of cells in our body. And it's a storm. Why is it called a storm? Where the body's army rebels against its own self. Cytokines generally try and help the body. Whereas in a cytokine storm, when the cytokines are released in the body, then the body rebels against itself and tissues are taken up by these cells, and slowly multi-organ failure takes place. It's a very serious manifestation of the COVID pandemic right now. And once you go inside the cytokine storm, it is very, very hard for us to get back the patient.
Okay. Now, recently, WHO has ruled out the usage of remdesivir and plasma also. So what are the recent advances in medicines for a COVID patient, keeping that in mind?
You have a point there. When this convalescent plasma therapy, the CPT as it's called, was started, so we used to take out the plasma. So the blood consists of plasma and the red blood cells primarily, right? So we used to separate them, centrifuge them. And since these plasma would contain the antibodies of a recovered patient, so scientists thought maybe, these antibodies which are there in a recovered patient would help others from treatment, by getting treatment with this. But what we saw was that we didn't really get any major benefits out of this. Patients were still getting progressive to serious disease. We didn't see any benefits out of both these, remdesivir and convalescent plasma therapy. There was no real benefit out of these, so we decided to discontinue them right now. Remdesivir also, when it came in use, it was primarily for hepatitis C and the Ebola virus. And we thought that maybe it will help us in this COVID pandemic also, and we used it and it helped us also. But then what scientists are now realizing is there's not really much benefit, and that is why it is being discontinued now.
Okay. Any recent advances in medicines to a COVID patient?
Yeah. Recent advances in medicine are, first of all, scientists are developing a nasal spray. It's called a nitric oxide spray, and that could prove to be a real godsend treatment for us, in the sense that this nitric oxide spray will kill the virus in the posterior nasopharynx, where it is lodged initially. So this is one nasal spray that has come. Then we also have the anosmic smell tester, because studies said that the loss of smell is the earliest predictor. So there is a company in Canada, Viracure, which is bringing this up right now. So the anosmic smell tester, if you can smell it, then you're COVID negative. If you can't smell it, you're COVID positive. So what it has is 12 natural ingredients. And as the olfactory region of the nose gets blocked by the COVID pandemic, so these olfactory regions are the first to go to get blocked. And this smell tester helps us. So if you can smell it, then you are COVID negative because your loss of smell is intact. There's no, your sense of smell is intact. Whereas if you can't smell it, then probably you are COVID positive. So these are some of the recent advances in the field of medicine. We are trying different things, and new types of masks have come. New types of masks have come. We were using the N95 mask, the usual N95 that we have. So we've now progressed to the N99 mask. I can show you this right now, the N99 mask, though I'm not a sales agent for this, but it's kind of helpful, These are filters here, which can be reused, right? Which can be removed and used again. So this kind of helps us, and it allays our anxiety as we go right deep inside the ICU and interact with patients of COVID. We are treating patients of COVID. This at least helps us to prevent the viruses from entering our body. So quite a few recent advances there. Yeah.
So Dr. Tarun Lall, there are a lot of controversies regarding the use of steroids also. Some say it's not right. Some say it's the best thing that can happen just now. Your views on it?
Yeah, you're right, ma'am. There's a big hue and cry right now all over our state that the indiscriminate use of steroids is being linked to the black fungus, the mucormycosis infection. So my say on that is that this indiscriminate use of steroids could be a problem, but besides steroid use, the sanitation problems, the industrial use of oxygen, these are other factors in causing the mucormycosis infection. We have been using steroids for up to a number of years, and we have not seen the kind of infections that are now being prevalent. We could also attribute this to probably the low immunity, because steroids do reduce your immune system, but do reduce your immunity. So that could be one factor. But I would say that the latest black fungus infections and all could be related to unsanitary conditions, the water, the soil problems. That would be my say on this.
Okay. Now there's a very interesting question rather, is that recently Baba Ramdev has said that allopathy is a stupid science and that it has failed to treat COVID-19 patients. In that light, would you agree with him?
I respect Baba Ramdev a lot. But having said that, he has his views. Everyone has their own perspectives on life, right? So what I would say is that there is a lot of scientific evidence backing most of the allopathic medicines. So there are hundreds and hundreds of scientific journals, hundreds and hundreds of studies being undertaken on every aspect of allopathy. So I wouldn't just reduce it to trash, allopathy is there. And I have utmost respect for our homeopathy, for Ayurvedic, all the different sciences are there and they all help. So primarily our target should be how to treat, how to increase the well-being of a patient. Depends on whichever mode of science you are taking, be it homeopathy, Ayurvedic, allopathy, whichever way it goes.
So does allopathy and homeopathy, are they helpful in treating COVID anyways?
See, I would say that there are a lot of homeopathic medicines also, Ayurvedic medicines also being prescribed for this COVID virus right now, right? Primarily, they would be immune boosters right now. What I see is that the homemade brews of tulsi, ginger, garlic, cloves, lime, all these would help us in boosting up our immunity. While in really, really treating the COVID, which is basically a very, very virulent form of pneumonia. So where I would certainly prescribe allopathic medicines for it.
Okay. Now, if you can tell us some after effects of COVID-19, when people who have recovered from COVID-19, so they are experiencing quite a lot of other changes.
Yeah, I myself have gone through it, ma'am. So I know what 40 days post-COVID, the steroids, they cause increased gastritis. I know for days I couldn't make myself understand what's happening. Why is there so much pain in the stomach? And then maybe I realized it was because of gastritis, the steroids which we were taking. So those were causing gastritis for me, Then constipation, weakness is there for so many months post-COVID. The weakness, the pain in the joints, the pain in the arms, pain in the legs, it's all there. So post-COVID problems are there a lot.
Okay, now there's another point of black marketing. We've heard a lot of black marketing at this point of time going on for whatever medicines, be it oxygen, be it beds. Please tell us something about it. I'm sure you experienced also.
Yeah. It's human psyche, I guess. That's how I will attribute it. The best of people in my hospital also, I have seen them being trapped by the Anti-Corruption Bureau and all that. They were very good people, and I don't know how. So what I feel is any crisis, the lure of easy money tempts the human psyche to go for it, and it has a very short shelf life, It has a very short shelf. You get trapped, you get caught, and then you spend hundreds of years trying to explain that you didn't do this or you didn't do that. So there's a huge black marketing for oxygen because oxygen is in very high demand these days, oxygen cylinders. People are hoarding oxygen cylinders. People are hoarding up different things, Nowadays, beds in a hospital, people are craving for beds in a hospital, say ICU beds. They are being sold by these small time, racketeers, who think that getting quick money is the easiest way to success. No, their money doesn't hang on a tree. Money doesn't come easily. You have to work and work hard and sincerity. Only then. It's a long-term shelf life. It's not, you try and get a quick access. There's no quick route there. So oxygen shortage, all these black marketers are there inside the hospital. Yeah.
So you agree that's happening?
Oh, yeah, it's happening, right? Yeah.
So if I were to ask you, what would be the actual cost of a treatment of, say, a COVID patient, taking all into account?
Taking all the allopathic treatment, I wouldn't be able to really zoom in on the price. But I would say that 5 medicines would suffice. 5 medicines. One antibiotic. One is like antacid, right? A little bit of, so say tazobactam, right? Tazobactam is an antibiotic. Then pentoside is an antacid. Maybe remdesivir and one antiviral, right? So like that, there's just 5 medicines and a little bit of oxygen, right? A little bit of oxygen, antibiotics, antacids, remdesivir, right? This will help us cure the disease, like
that. What I'm asking is that cost will also include ICU charges.
ICU, yeah. Besides, if you are in grievous, serious COVID infection, then you would require ICU where the oxygen support would be required. So oxygen cylinders are required, ventilators are required. That would really rake up your costs. A cost of a ventilator is huge. So this is like very expensive. We in the government hospital, everything is free. Everything is free.
That's exactly what I'm trying to know, is that although the government is in government hospitals, the treatment is free. But if we were to talk about a general costing analysis of a patient of COVID with all these, how much in your estimate should it be actually?
In the private sector, I've heard that it's, Are you asking about the private sector? Yeah, you're asking about the private sector? Yeah, just like that, So taking into account the ventilator, the constant oxygen support, the steroid treatment, the antibiotic treatment, the HRCT that we get regularly, I would say 50,000 would be and easy price. 50,000 would be there. But depending on how much you're using oxygen, depending on how much you're using the medicines, right? That could lower your cost to say 5,000. So I would say a rough estimate would be 5 to 10,000 would be there. Yeah.
Okay. Now, moving on a little, I would like to ask you, could this second wave of corona, which has seen such a lot of disaster, could it have been better handled?
No, I'll tell you something about it.
In also the light that ICMR had written of sometimes back, written a letter to the Health Ministry, Government of India,
Yeah, yeah,
giving
yeah.
recommendations of lot of things and saying that the second wave is coming and
Yeah.
trying to caution the government. But in the letter says that their letters were all trashed and thrown in the dustbin by the ministry.
I wouldn't really agree to it, ma'am. Why I wouldn't agree is because I'm a part of that government sector, right? So in early part, the first week of December, we were given additional charges of a COVID designated center, the Rajasthan University of Health Sciences. The first wave was declining, right, in December, but we were already told that we are anticipating a second wave and you'd better get everything started now. So there was silver lining to this second wave that we were prepared for it. We had liquid oxygen, we had all the best of ventilators, we had 205 bedded ICUs, high dependency units, post COVID wards. We used to attend our classes every day, see different types of treatments, modes. So we were prepared for it. I'm being very straight with you on that we were prepared for it and we were very well prepared for it. That's for sure. And now, as we are anticipating the third wave, and which could hit the children the most, are pediatric hospitals, right? SMS Hospital consists of pediatric hospital, women's hospital, trauma center, Rajasthan University of Health Sciences, a lot, 12 hospitals embedded in one, brand, that is the Savai Man Singh Medical College brand. So our pediatric J.K. Lal Hospital is now gearing up. So a liquid oxygen tank is being uh, built there. So people are getting ready now, anticipating the third wave. We are having video conferences with all our respected secretaries, with our respected health ministers and our chief minister. So we are anticipating everything and we are taking stock of the situation.
You just now said that you all were prepared for the second wave. But in spite of that, there have been so many deaths that have taken place in Rajasthan, uncounted. And the upsurge was tremendous in Rajasthan also, which was appearing quite not handleable.
Yeah, no, we handle it very well. The only thing was the surge, the onslaught of patients was so much. Like we had a 1,200 bedded hospital, right? And suddenly in the night, 300 people entered. We were already loaded to capacity. And from 1,200, we jumped to 1,600, 400 patients more. So we had to put patients in the hall. But that was just a temporary, transitory method that we used because we just felt overwhelmed by them. But then quickly, we had a quick turnover time. We decided, okay, let's have a quick turnover time from the ICU to the high dependency unit, from the high dependency unit to the special ward. And from the special ward, we would send the patients to their home, advising them to use oxygen concentrators or oxygen cylinders at their home and keep on exercising and doing the prone position. So we had a very quick turnover time. That is what I would like to say.
Okay. Now you just also talked about black fungus being, people being infected by black fungus because of the industrial oxygen.
Yeah,
Yeah.
you have
So
a point there. Yes, I did talk about it. Yeah.
yeah.
So
So
what is happening is this black fungus disease has come up, in our hospitals so much, and we're trying to focus. We're trying to zoom in on the causative organism or the causative part. What is really causing it? And we are kind of baffled right now. Studies are happening. We are seeing two things. One is, of course, steroids. One is the industrial oxygen that might have come in some of the cylinders, by accident or whatever, right? So because in Rajasthan University of Health Sciences, we don't have many cases of black fungus, in Rajasthan University because we're using liquid oxygen tank. A liquid oxygen tank has a capacity of 70 to 80,000 liters. of oxygen, and we fill up our oxygen cylinders from that liquid oxygen tank. So as of now, indiscriminate use of steroids, industrial use of industrial oxygen cylinders. So a lot of causative things, we're pointing fingers right now. But yes, this black fungus, which is caused by uh, mucor mold, it's present in the mold, in the soil and all. So it is causing alarm in our hospitals right now. And we need to really focus on this too.
What is the treatment for black fungus?
Amphotericin B is the main treatment. That's the antifungal treatment, amphotericin B, right? So we are using injection amphotericin for it. And besides that, we try and operate. If it goes way inside the brain, then we try and operate it from the nose. So basically what is happening is there's a blackish discoloration around the nose and here near the eyes. So we try and remove it by surgery as well as by antifungal treatment.
Okay, now has Rajasthan government made a global demand for vaccinations?
Vaccination as such, we finished off the 45 plus, people. We finished vaccinating them, and now we are having the 18 plus vaccinations going on. So the Sputnik virus, the Sputnik vaccine is here now in our state, the Sputnik vaccine. So probably our respected Chief Minister sir must have asked for the Sputnik vaccine, which is available right now. So we are hearing that other types of vaccines are also coming in our state. As of now, we are using Covishield and Covaxin. And besides these two, Sputnik has also come.
If you could tell us, the healthcare sector people, also the doctors and healthcare workers also must be facing a lot of difficulties. You're really doing a great job. If you could tell us some difficulties that you come across in the upsurge.
We look very strong, we look very strong and invincible right in front of you. But we know, and I know my resident doctors, there are 200 of them, resident doctors of anesthesia, 200 of medicine. They're all over our hospital right now. But I see the anxiety in their faces, So what if I'm next? 409 doctors have died so far. And we are right inside. We are intubating a patient. We are opening the mouth of the patient, taking the respiratory tract organisms, all of them. So it's a huge risk for us. It's a huge risk for us. But as I said, the positive part is that we are vaccinated, right? Our immune system is strong. But yes, the anxiety is there in all of us. I wouldn't deny that. The anxiety is huge. And when we talk about it, we try and laugh it off. But yes, the anxiety is there. And we pray to the good Lord to help us out in this. We pray for your blessings, all the blessings of our people to help us fight this pandemic right now.
Okay, now there you must have come across the reports that in UP and many other places, Bihar, bodies have been just thrown in the river and also buried at the riverside. Now, is there a danger of an epidemic here also? Another kind of epidemic?
Yeah, they should not have done this, whoever they are. I don't know. They must be having some religious practices, some religious beliefs, And basic is that they feel very, very, they don't want to touch this dead body consisting of a COVID infected patient, But what I have to say is that we have mortuary rules here. I'm heading the mortuary department in this. So we generally, once the patient dies of a COVID infection, we put them in body bags, and then there is a special crematorium. So we try our level best not to allow the patients and their families, not to allow the families of the patients to take the body back home. There is a crematorium specially built for this arena. And so we try that COVID-19 patients come and get cremated directly. This would later on cause problems in the water, perhaps, So this practice of dumping bodies in the rivers should be banned and should be disregarded as much as possible. Yeah.
But doctor, they mustn't have done it with their will, Nobody in India will like to do something with their loved ones. Surely there was lack of space in the crematoriums. As you said, they wouldn't like to touch the body. There were very many videos which said they were taking it on a JCB machine, to dump the body. basically it is lack of the infrastructure, crematorium, no places. There was so much crowd. That is why they did something like this.
I would agree with you on
And
that.
maybe
I would
Rajasthan
agree.
government has that much space in the crematoriums.
Yeah,
And
what
the
we are
poor
saying
also
is,
were, the
yeah,
poor
yeah,
didn't have
you're
money
right.
also to do that.
Yeah, yeah. As I said, ignorance is bliss, you know. So what I mean to say is, as much as possible, try your level best, you know. We need to educate the public. We need to educate the public that it's okay, once a patient dies, there's a body back to it. Go in the crematorium, right? Besides the crematorium, we have incinerators also now, you know, so they can incinerate the body immediately with that. But don't dump the body, for Christ's sake, you know. Don't dump the body in the river, because it will spread infection unnecessarily. So we need to educate the public about this. That would be our goal. We are already having psychiatrists here. We are already having, so psychiatrists and all of us doctors who are coming on TV, educating the public. We need to have public education handouts, you know, education handouts to the public, the do's and don'ts, you know. So I would suggest that some do's and don'ts be made for this, so that the public can understand why going to dumping the body in a river is not beneficial to anyone.
Actually, that's better said than done, because
Yeah,
when poor
yeah. Lot
people
of
are,
things. A
yeah,
lot of things are better said than done, and that's how
yeah.
it goes, you know. Yeah, it
So
happens. It
another
happens.
question is that there is an Indian variant which they are saying these days. Yeah. So
It's the B.
what is so
It's the
different about
B.
the Indian variant?
Yeah, the B 1.6372 virus variant is there. What exactly was different about this is that it was pretty similar to the UK virus and the Brazil virus, but what we realized was that it was more contagious. It was more contagious. It had three different symptoms which are not there. The red coloration of the eyes, the stomach problems, these were not there in the other viruses. So this Indian virus, the B3.6172 virus, so this had its share of different symptoms from the previous pandemic, the first wave. So this did affect us. We did not know about this. The red discoloration of the eyes, the pain in abdomen. These were some differences with this Indian virus. It was more contagious. We saw families. One person would get infected in a family, the whole family would get infected. We never saw this in the first wave. First, one person would be there. We would quarantine that person in their home. But this time, full families. I have lots of horror tales to tell you about that. Full families getting lost in this COVID pandemic.
So the present medication regime is working for that also.
Oh
It's
yes,
all
the
one.
present. Yeah, it's all. We have a package here. We know exactly, as I said, serious patient has a different package. A less than serious patient has a different package. So we have different packages for different patients. Yeah.
Okay. And what about this CT scan? The issue about CT scan and X-ray. Uh,
CT scan is more beneficial, right? A CT scan is more beneficial than an X-ray, because what we do is we divide the lung. We divide the lung in 25 zones, right? We divide the lung in 25 zones. That can only happen with a CT scan, the division of lungs, right? And then we give a score. So say 10 parts of the lung are affected out of the 25. So we know that 10 out of 25 is a score, right? Now 23 out of 25 would be a major score, and this patient needs to go straight to the ICU. So this high resolution CT scan has a lot of benefit, and as of now, it is the real diagnosis. Sometimes this variant can bypass an RT-PCR. So RT-PCR is negative, but you're getting a CT score of 23, or you're getting your CT scan is totally abnormal. So we are relying a lot on the CT scan to help us differentiate patients between mild, moderate, and severe. We are relying a lot on the CT scan. That's why a CT scan is very good right now.
are you expecting a third wave and a serious kind of third wave?
Yes, we are expecting a third wave, all right. Yeah, we are expecting it by October. As of now, I'm hearing that 300 cases have already come in the state of Maharashtra right now. So we are kind of in the state of Rajasthan. I feel that probably mid-October we should be getting hit by this, but we are preparing. and we're getting ready for this. We're hearing that children may be more susceptible to this. Primarily the cause is that children have not been vaccinated as yet, right? Children have not been vaccinated as yet, so children are so ready to play, they want to play outside and all that. But this is the problem with them, that they cannot go out so easily right now. So they would be more susceptible right now to this variant, the third wave. As they go out to play, they need to meet, they need to play in the soil, they need to play in the garden. So they are more susceptible right now. So our pediatric hospitals are gearing up for this third wave.
So are you expecting it to be that lethal and fatal as the second one?
I'm hearing conflicting reports whether it would be that lethal or not. Whether it is lethal or repressive, we don't know for sure. But yes, as we get people more and more vaccinated, right? So the chances of it being more lethal, more fatal, tend to decrease. So the key is lockdown, vaccination, mask. These would be the three, and social distancing, the fourth one. The lockdown has really helped us. The lockdown has really helped us. So I would say our government has really done it. They've extended the lockdown now, and we would be thinking that they would, once the third wave starts, we would be probably be sure that the lockdown would get extended. So lockdown is very important right now, and that would really help us curb this third wave.
My final question, what will be your advice and message to the people and the government both?
My message is, don't panic. Don't panic. Just don't panic. Yeah. I have seen a lot of war stories, who won. The people who won were not really very brave or anything like that, but they didn't panic. So we know so much about this virus. We've learned so much about this virus. So I say to all our fellow beings, do not panic. You've learned a lot. Face it. Face it. Don't run away from it. Just face it. Tell this evil virus, bring it on. Tell this evil virus, bring it on, Help yourself, help others, Help others, help yourself. Be very educated now. There are TV interviews, there are TV shows going on. They tell you, you can wear a mask even if it is of a cloth. Even if it is of a cloth, wear it. Cover your nose. This is the most fragile area of your body right now in this COVID pandemic. So cover your mouth, cover your nose. Social distancing is such a must right now. Lockdown is there. Remember all these things. Take homemade brews of lime, garlic, cloves, ginger, turmeric, all these, and help others also. Be kind and make a gratitude list early in the morning. We've seen.
But how about the poor people? What will you tell the poor people to do? They may not be having access.
Be it poor or rich, doesn't matter. The smallest of these, a cloth mask wouldn't cost you much. Small tablets, would be probably a 40-50 rupees, Lime C, vitamin C, zinc. These would be very cheap medicines, Start this, homemade brews, start this, right? This will help you. 50 rupees would not harm you that much. So in 50 rupees, you can prevent this.
And what do you expect from the government?
The government is giving us a lot, ma'am. The government has, you have to see the Rajasthan Institute of Health Sciences. We are so well stocked up. We are so well stocked up with ventilators. We had problems with the ventilators. Immediately, new ventilators have come up, Standby ventilators, standby oxygen concentrators, standby BiPAP machines, everything. Tocilizumab medicine, it's 50,000 rupees. You come to our hospital, any patient who wants it has it. Like that. So we cannot expect so much, We have a great government that way.
There's no scarcity of anything.
There's no scarcity. Our principal, Dr. Sudeep Bhandari, sir, our superintendent, Dr. Ajit Singh, they're doing their best, believe me. Our health minister, he's every time talking to us, helping us out in this. Our chief minister, we are having video conferencing with all our secretaries and all. It's no easy game. All of us, I would say, are working round the clock to contain this pandemic. Yeah.
Thank you so much, Dr. Tarun Lall. It's been a pleasure having you on my show, and so much information that you've shared with us. I'm sure it will be of great help to people who will watch the show. Thank you once again.
Thank you very much, ma'am, for having me on your show. Thanks a lot.